and Child Health Research Seminar. The seminar is held on the second and fourth Mondays from September through June, and the series includes speakers with work focused on child health from both UCSF as well as guest speakers. Please let me know via email if you're interested in speaking or would like to suggest a speaker. Looking ahead to our next seminar on May 13th, we'll be welcoming Dr. Luke Judge from the Division of Neonatology. We're still virtual and using Zoom, and we'll ask everyone to stay muted unless you have a question. We'll open it up at the end to questions, and I understand there's an interactive component as well, so pay attention. Today, we're welcoming Dr. Anda Kuo from the Division of General Pediatrics at Zuckerberg San Francisco General. Anda is a professor of pediatrics, departmental director of health equity and community engagement, co-director of the UCSF Center of Child and Community Health, and founding director of the UCSF Plus program, which is the Pediatric Leaders Advancing Health Equity. She also held the Academy of Medical Educators Endowed Chair in Pediatric Education from 2013 to 2023. She's the senior advisor for the UCLA UCSF ACEs Aware Family Resilience Network, where she's focused on the establishment of partner and patient councils. Her research is focused on community engagement with a particular focus on processes to help define youth-driven community research priorities and best practices for community advisory boards. I don't want to give too much away, so you'll be seeing everything unfold here. And she'll be joined today by other members of her team, as you saw in the invite, so I'll just allow Anda to introduce them as they come up. The collaborative work has been funded through PCORI. The title of the talk today is How to Apply Promising Practices to Elevate Youth Voice and Engagement Through Advisory Boards. Thanks so much, all of you, for joining us.
Thank you. Thanks for this opportunity. It's great to share and learn from everyone, as always. And I just want to acknowledge our colleague, Kathleen Tebb, who has real deep experience in youth engagement and partnership and research. And I think she may be joining us later. But regardless, we've been able to co-present some of these slides with her previously. So I'm just grateful for her partnership. So this is collaborative work, and this is even just part of our team. But we have members of our team here with us. And I may have, as we speak, I'll have them introduce themselves quickly. But we have Precious with us today, our YMCA True Program Coordinator, Cassandra, also our True Project Manager here at UCSF. Maggie's my co-PI with our PCORI Engagement Award. And then you'll also hear from Setareh and Setareh, who are our UCAN, or the UCLA Family Resilience, ACEs Family Resilience Network, and ACEs Aware Program Manager and Program Coordinator. Amazing team. So we're going to describe the benefits of engaging youth as advisors, articulate promising practices to meaningfully engage youth and young adults in advisory boards, and identify how these promising practices have been applied in existing youth advisory boards. And mostly really want to spend most of our time on the how and the what. So first, a little bit about what are the benefits or why to engage, and I'll try and do this relatively quickly because, again, I want to focus mostly on what and how. But some things we don't always think about. So we know there are benefits to youth. It's a space for them to share their interests, have agency to plan and make decisions about themselves, and policies and research that are affecting them, validity of the work and project itself, and it's important investment in youth development, of course, around civic engagement, skill building, and connection. As an educational health science campus, I think that's also very important to us. There is benefit to others, including us as researchers and educators. So there are a lot of different layers of why we should engage youth. And as adults working on areas that impact youth, such as their health, it improves our competencies. And I've experienced this over and over again in the past years as we've developed our different advisory councils. It has been really such an honor. It makes my day, honestly. I learn every time I'm engaging with them. So it improves our competencies. How do we work with youth best? The value of youth in our work, and how and why we should be prioritizing working with youth and increasing their commitment to youth and youth organizations. or increasing our commitment to youth and youth organizations. There's benefit to organizations, including research organizations, to improve their programs. And if you think about it, like, how do we create programs for youth or about youth without their expertise being included? So by engaging organizations and our research institution improves the validity and credibility of their work, and ultimately have a greater chance, at improving the effectiveness of their programs. And in the long term, of course, the communities benefit in the well-being of their community members by improving quality of life, community programming, and services for youth, and in creating an inclusive and more diverse ecosystem. So regarding health equity, I think we all know this, but it is youth population is progressively becoming more racially and ethnically diverse. By 2050, it's projected that 60% of adolescents in the US will identify as people of color. And in spite of all the money and efforts and time and expertise on our end going into health disparities and reducing health disparities, they're widening, especially impacting people of color. And improving the health and well-being of youth is a really important part of addressing health inequities. And it has been really enlightening to me to see how we approach things differently when we're in expertise really as an integrated part of the work that we're doing. Yet youth voices and their expertise are largely underrepresented in the design, delivery, and evaluation of health-related program interventions. So that's the quickly with the why. And I assume most of you already are interested since you're here. So we would, again, want to spend the majority of our time on the what and the how. So what are some of these promising practices? And here's one framework that I think is really helpful. It's developed by Roger Hart for UNICEF, and it's the ladder of participation, of youth participation that was based on an adult framework called Ladder of Citizen Participation. And I think it can be really useful when developing and reviewing your own engagement practices of your project or your research. It's this continuum of power. It has 8 rungs that you can see here. And it's a metaphorical ladder where each rung represents a level of youth agency, control, or power. And the ladder also represents a continuum of power that ascends from non-participation or no agency to degrees of participation with increasing levels of agency as you go up the ladder. So I think that these models are really important because it clarifies for an organization or a project what level of youth engagement they are at, or to decide on that level, and what level is desired and feasible. So it can help articulate clarity on the goals and purposes of engagement, and can support the design of the engagement to meet those goals. Because there are many factors affecting the extent to which youth participate other than the design of the program. And it's not necessarily, it doesn't necessarily make sense for youth to always operate on the highest possible rung of the ladder. It would be ideal, but given where any program is, it may not make sense. So different youth at different times might prefer to perform with varying degrees of involvement or responsibility, and the ability of a young person to participate varies greatly with their development. So you can imagine there are situations where certain circumstances could call for different levels of participation. For example, you may need to be at a lower rung of engagement in order to prepare youth and adults in the program to move up the ladder. So the most important thing really is to remember that programs should be designed to maximize the opportunity for any youth to choose to participate at the highest level of their ability, and that it occurs across the continuum. This is just one other framework I will put out there that we also use. It's developed by Rosa Gonzalez, and its emphasis is on the spectrum of community engagement that can be applied also to youth engagement as well. And I think this framework really helps organizations and programs to think through what level of engagement they're at and what activities are reflective of that. So you can see at the top, it's kind of like a broad category of engagement. But what I really like about this framework is that then it talks about what is the impact of that level and what's the message we're sending to community or youth. And then again, as I mentioned at the bottom, there are specific activities that can help you orient, like, where am I in the spectrum? So it's everything from ignore, where the impact is marginalization. The message to the community might be your voice, needs, and interests don't matter. These are closed door meetings, misinformation. If you go up to the middle, like consult, the impact could be tokenization, where you're gathering input from the community and the message is we care about what you think. This could be public comment, focus groups, community forums, surveys. And then if you go over to like collaborate, for example, where there's more of an impact of delegated power, the message is your leadership and expertise are critical to how we address the issue. And this might be reflected in activities like memorandums of understandings or MOUs with community-based organizations, community organizing, citizen advisory committees, open planning forums, and citizen polling. And then at the end, there's defer to and with community or ownership. So we're going to take a minute or two, if possible, to have you all engage with us a little bit. And if you think about this ladder of youth participation, where is your work on this ladder? Are young people being manipulated? Are they there for decoration? Some of these words are hard to hear, I know, but if we have to be honest with where we are they tokenized? Are young people assigned and informed? Are they consulted and informed? Is it at rung 6, an adult-initiated share decision with young people? And then young people lead and initiate action up to rung 8, young people and adults share decision-making. So if you think about your program, where are you on this rung? And is there a step you can take to move youth participation in your work up one step in the ladder? And then lastly, is there a barrier that you anticipate in moving up one step on that ladder? So we'd love just to hear from folks if they would want to unmute or put anything in the chat. And I'll give you a minute to digest that. I wish there was a way where we could take this thing down, but without losing the ladder, but I'll just see if I can see anybody.
Well, and I was just going to mention that, some of us work with very, very young patient populations.
Yeah.
And certainly I think all of us are trying to increase the level of family input into areas of research interest and research design and things like that. But
Yeah.
I don't know if there's any thoughts you have about how we can improve community engagement, even for those types of studies or study populations, I should say.
Yeah, and we didn't highlight it in this particular presentation. We do have a family advisory board for our work on the 0 to 5 population in San Francisco County around systems of care and care coordination. And that we have a family advisory board here in San Francisco and also in Oakland. And the Oakland group's focusing on a residency curriculum on early relational health. And it's really the same principles, honestly. As I mentioned earlier, the Roger Hart ladder was based on an adult in participation, similar kind of model. And that community participation spectrum that we had is really for any, could be like community participation, caregiver participation. So if anyone wants to comment also on their work with families, that's totally welcome too. And we'll address it a little bit. So anyone else wanna chime in? We'll give you like 30 more seconds to unmute or put it in the chat.
I'd like to chime in about our experience. I mean, I'm one of the presenters, and even if you're working with young people like age 12, and say, for example, our youth advisory board has members as young as 16, but not 12, they still remember what it was like to be 12, more so than their parents and caregivers may. And so to consider that as well.
Great. Okay, well, we'll keep going, and people store up your questions if you have any for the we might have time for Q&A at the end. So I'm actually going to have you keep going.
Yeah, so I'm going to talk to you all about promising practices for advisory boards, and we're going to tell you a little bit about youth specific. The following promising practices come from the Center for Healthcare Strategies Best Practices infographic and literature review that was done by Prabhat Minhas and myself on community engagement in research and practice. We'll talk about 5 things today and how we did them in our separate councils. The first one is take the time to lay the groundwork, and I'll talk more in detail later, but this means setting up the infrastructure, goals, roles, and expectations. Secondly, recruit members with intention. Third, compensate members for their expertise. 4, reduce barriers to participation, and we talk about multiple kinds of barriers. And then number 5, support meaningful participation. Next slide. So we'll start off with 2 examples, and I'll start off with the first example. You could go to the next slide, Cassandra. Thank you. So it's been a real honor to work with our multiple advisory councils and patient advisors for the UCLA UCSF ACEs Aware Family Resilience Network. We'll be referring to it as UCAN today. UCAN implements the ACEs Aware program on behalf of the California Department of Healthcare Services and the Office of the California Surgeon General. ACEs Aware is the first in the nation effort to promote early detection and intervention to mitigate the health and societal impacts of ACEs, adverse childhood experiences, and toxic stress. ACEs Aware is a clinical training initiative, and therefore its mission is to educate, train, and support the California healthcare workforce to be able to identify, prevent, and treat the impacts of ACEs and toxic stress across the lifespan. Next slide. ACEs Aware. At ACEs Aware, we created 2 separate advisory groups with youth and young adults. We were looking for 15 individuals ages 16 to 26 years old for a youth and young adult council who represent the diversity of California's Medi-Cal population, and we received an enormous response to our call for applications. On the right, you could see our recruitment flyer. And so we also wanted to move toward collaboration and deferment of power on that spectrum of community engagement that Anda was sharing earlier. And so to do that, we identified 6 of the applicants to work with us as patient advisors who demonstrated additional leadership experience and skills and who could work with us for up to 20 hours a month. We brought on these 6 applicants, or 6 patient consultants, 3 months before the other council members. And this group of young adult patient advisors helped us finalize the candidates for the 15 council members, and they worked with us to set agendas, and they continue to work with us to set agendas and to facilitate our monthly council meetings. Moving on to the first promising practice, laying the groundwork. As I mentioned, this means defining goals, roles, expectations, and scope. In our experience, a lot of funded projects don't include the incorporation of lived expertise as a deliverable. And even if they do, they may forget to fund this adequately. This requires a lot of staff time to manage barrier removal funds and compensation, which we'll talk about later. This may be changing over time. It seems, however, that with increasing frequency with value statements such as regarding equity, it's important to find points of alignment with initiative priorities and to establish buy-in by leadership and decision makers. So part of the buy-in and creation of clarity was by drafting and vetting a workflow for how we would incorporate our advisory boards into the decision-making process. And lastly, when we brought on our young adult advisors, we made sure to review certain groundwork items with them, such as community guidelines, letters of acceptance to the council members, letters of rejection to the council members that didn't get it. We received 177 applicants for 15 spots, so it was quite the challenge. Next slide, I'd like to talk a little bit about the goals that we had. And this was part of laying the groundwork. Our goals of the youth and young adult councils was to offer input, experience, and lived perspective on guiding principles, priorities, and strategies of ACEs Aware, to provide feedback on specific products, including frameworks, clinical competencies, tools, resources, trainings, clinical workflows, and evaluation metrics, to guide the identification and interpretation of evidence that informs clinical practice, education, and training. Next up is promising practice number 2. You could go to the next slide. Thank you. So this is members recruitment. So it's important to utilize a variety of recruitment strategies, such as word of mouth, social media, and recommendations from community-based organizations and other institutions. There's actually an article by the NIH Translational Science Award grantees and thank you, Setareh, for posting it in the chat, the link to that, where they shared that 80% of their patient advisors were recruited by someone they know, and only 20% were recruited by flyers and ads. And so word of mouth is very important to getting that diversity. In the end, many of our own youth and adult applicants mentioned that they had found out about this opportunity from a counselor, teacher, or mentor. It's also important to recruit with intention and have a list of underrepresented populations that you may want to include in your councils. And related to that, it's good to have a selection rubric to reduce any selection bias and to make sure that you're not filling the advisory board with individuals who have the same types of experience. We recruited on a rolling basis to give people time for that word of mouth to reach other individuals and communities. And we recruited participants starting at 16 years old because their expertise was much different from the 26-year-olds in our group. And at ACEs Aware, again, our young adult leads helped us plan all the aspects of the youth and young adult council, including selecting the final candidates, setting the agendas, and community agreements. The QR code on the right will take you to the nomination form that we asked our community partners council about on CBOs that helped us reach different target people. And so I'm going to show you that on the next slide, actually. I'll go a little bit into depth about the recruitment process. So for our clinical training initiative, we knew that we wanted patients representative of the Medi-Cal population. So we first looked at the Medi-Cal population demographics to ensure that our recruited council members would be similar. Then we listed some underrepresented demographics we wanted to include: foster youth, system impacted youth, rural and coastal communities, Native Americans, immigrants, etc. Then we sourced a list of community-based organizations who work on the ground closely with patients and families based on those demographics, and we reached out to them to share this opportunity. We met with UCSF's CTSI, Clinical Translational Science Initiative, I think, and the Center for Child and Community Engagement to get feedback on our process. And then we sent the call for applications to all the organizations via personal invitation. And then one last thing we did is we saved some open positions on our board in case we were unable to recruit a specific underrepresented group in that 8-week period. And then we would take more time to recruit that group. If you take a look at the next slide, you'll see that our recruitment process, it was successful. We had received 177 applicants for these 15 positions. And you can see that on the map, we had applicants throughout the different regions of California, with many applications being the Bay Area and Southern California, where our networks were very rich. But we did really try to reach all 10 regions in California. One take-home lesson we had that we didn't do was we wanted to ask optional questions about various lived experiences to recruit a diverse group. We didn't ask these questions. People kind of in their answers to our standard questions self-identified certain lived experiences, but it would have been nice to ask an optional question about these experiences upfront. So 5 of our applicants identified as being unhoused, 14 applicants identified as being foster youth, and that's because we had reached out to a couple of agencies, organizations who really put the word out with their members. We had 3 applicants who were either pregnant or young parents. 2 applicants self-identified that they were in the carceral system, but are previously in the carceral system. And when we actually brought people on, we realized that was more. So it was nice to know that later on. And then 6 applicants self-identified as LGBTIQQ. Our third promising practice is compensating members for their expertise. And so it's so important to value the time and expertise of our members with hourly wages, honoraria, gift cards, and more. And we really collaborated with the young adult leads to determine appropriate methods for compensation. And so I want us to think creatively at UCSF regarding reimbursement. We actually outsource the compensation with a subcontractor so that our council members do not have to invoice individually. Typically, patient advisors, for every meeting, they'll have to invoice UCSF, and we didn't want to put that burden on them. And we also gave council members many options for payment: Venmo, Zelle, Apple Pay, Amazon gift card, and Target gift cards. And the next promising practice is to reduce barriers to participation. So consider the population that you work with. We were working with youth and young adults, and so we considered meeting after school or work. Since ours was statewide, it was virtual, which helped folks a lot. But we did budget for in-person meetings so that we can further build community. We also provided childcare compensation. So even though we were virtual, we wanted to make sure that the parents or caregivers that we had were able to participate and really be focused intently in our meetings. And so they would get childcare at their home and get compensated for that. Also, barrier removal funds included getting equipment or internet to join our virtual meetings. And we worked on identifying other barriers that were not financially related, such as how do I fill out this W-9 form without a social security number, etc. The last promising practice I'll mention is supporting meaningful participation. So we included young adult leaders to determine the agenda and facilitate council meetings. And this was excellent because it really helped us to build a safe, brave, and trusted space. With those young adult leads helping us create community agreements, playing games, spending lots of time building relationships. That was one of the key things that came up in our literature review, is like, we have a 90-minute meeting and we make sure that there's not more than 1 hour of actual work time. It's very important to build those relationships to have that safe, brave, and trusted space and really get the input that you need. We've offered multiple trainings. Lastly, we had our young adult patient advisors did a 6-week training on Deduce, which is a qualitative method software that we plan to use to analyze the themes from our meetings, and they are helping us develop the evaluation questions, code books, and do the textual analysis of our youth and young adult council meetings. Other ways of supporting the meaningful participation, as I said, is like that trust building through icebreakers. And I was just in an interview today of one of our youth and young adult council members, and they asked her, how has it been for you? And she said it's been healing because I'm in a space with other youth and young adults who are just like me. I thought I was like the only one. So I'll pass it on to Setareh.
Thank you. We also wanted to share some examples of the impacts that our youth and young adult council members and patient advisors have had on ACEs Aware and UCAN work. Our young adults actually gave feedback on the ACEs Aware Stress Busters patient handouts, which were adapted to be more culturally acceptable and youth-friendly. And basically, Stress Busters are 7 evidence-based ways to manage stress. You can actually access these patient handouts as well as a 5-hour virtual training at acesaware.org/manage stress, or you can also scan the QR code, and I will go ahead. Thanks, Sarah, for putting that in the chat. But basically, if you do the 5-hour training, you will be qualified for continuing education credit as well. In addition, two of our young adult patient advisors presented a webinar highlighting how clinical teams and community-based organizations can support formerly incarcerated youth. It was attended by over 100 people in the ACES community and many more registered. And you can also view the transcript and recording of this webinar. And Sarah has put that link in the chat. Also, we had two patient advisor representatives sit on a working group for the ACEs and Trauma-Informed Care in Reproductive Health three-part webinar series. For Reproductive Health Working Group, our patient advisors provided input on outreach opportunities, strategies, and they also provided feedback on the webinar slides. And this really, by sitting in all of these meetings, this ensured that they were part of the decision-making. And Sarah will go ahead and put that link in the chat where you can watch the recordings of the three webinars. Our leadership, also another exciting opportunity was that they connected us with the Office of the California Surgeon General when we found out that they were about to create a Youth and Young Adult Council to inform their statewide ACEs and toxic stress healing-centered awareness campaign. We have met with the team that's responsible for creating this campaign over 6 months. And our youth and young adults have provided feedback on the name of the campaign, the tagline, the hashtags, the colors, the mood boards, and they also submitted photos and videos that were going to be part of the campaign. And the campaign will launch next month during May Mental Health Month. And on the left, you can see pictures of our Youth and Young Adult Advisory Council, and the photo on the right comes from some of the feedback that was shared by our Youth and Young Adult Council members in one of the listening sessions that they attended. Thanks, Sarah. And then the link is in the chat where you can access the statewide campaign. And another exciting opportunity was that some of our young adult patient advisors were featured in an official video by the Office of the California Surgeon General on the statewide ACEs and toxic stress campaign that you may watch at healtogethercalifornia.org. Sarah will put that website in the chat as well. And our team highly recommends you to watch this video because it's really powerful. Thank you, and I'll pass it to Cassandra.
Thank you, Setareh. The second program we would like to highlight is the Transforming Research as Usual for Equity, also known as TRUE. And this program is done in partnership with the YMCA of San Francisco and with PCORI Engagement Award funding. And we recruited and trained 20 SF Bay Area youth to serve on the Youth Research Advisory Council, also known as the YRAC. And these are public high school students between the ages of 14 to 18. We also recruited and trained 3 youth research leads. And these are young adult staff members at the YMCA in their late 20s, early 30s. And they've been essential in co-designing our program and facilitating our council meetings. And the goal of the YRAC is to act as a mechanism for historically marginalized youth to drive medical research that promotes health equity. And the youth were trained using an intensive research methodology curriculum that was co-developed with the youth during an iterative process. And the youth met monthly to complete the 7 modules in the curriculum. And so far, we've had 2 cohorts of youth complete this process and are now available to consult on research projects. For the training curriculum, the goal was to create a standardized curriculum to train them on research and to empower them to share their lived experience on a council. And as I mentioned, we co-developed this with the youth and we went through multiple iterations. And we developed 7 modules, and the topics included introducing the youth to the YRAC and other topics such as health and health equity, social determinants of health, advocating for yourself and your community, conflict management and resolution, an introduction to medical research, and ethics in research and racism in health. And at the end of this program, the youth were able to work with researchers and to give their input on research projects. So I will pass it to Precious to go over the promising practices.
Thank you, Cassandra, and good afternoon, everyone. My name is Precious Ogbonna, and I'm an Associate Director over at the Buchannan YMCA with the YMCA of Greater San Francisco. And so I am the coordinator on the Y side for this program. And here are just some of the promising practice, like Sada mentioned earlier. So of course you want to take the time to like build that community and make sure they feel comfortable and they feel welcome and accepted in the space, and that they also are aware of like what their expectations are around behavior and the outcomes of our time together. But understanding that building that relationship, that's like one of the main like keys to like foundation of the project, and making sure that when you're engaging youth that they trust you and that they feel comfortable with you. But also like being sure, like to Anda's point earlier, that you're not getting them to trust you for like tokenizing purposes or for extraction culture purposes, and letting them know that this is like a two-way street. And that's where we kind of come in as the why, that this is a two-way street relationship. Like, yes, we need something from you, but also please, whatever you need from us, let us know so that we can support. And so we do that with community building. It could be check-in questions, it could be activities, it could be games, but making sure that they feel comfortable to share space with each other, because some of these youth are used to youth-friendly or youth-positive spaces in other community-based organizations. So they're aware of what that relationship building process looks like, but they're sharing a space with other youth that they don't know and other adults they don't know. So making sure that we're doing the work to build those relationships, that's one of the most fundamental parts of getting the project started. And then for our next promising practice, the compensation piece. So money obviously was like a huge draw for the young people. And so that's what gets their foot in the door, but what keeps them, right? So we've experimented. So we had a stipend where like once they were finished, they had gift cards and stuff like that. We've also brainstormed like what wages could look like, understanding that youth in other programs or in parallel programs are earning wages every 2 weeks. And those youth, they don't tend to struggle as much when it comes to attendance. But what could support attendance and coming could be like that regular compensation factor. And in addition to that, they were given jackets, and you can see that in some of these photos. We're all wearing our matching jackets, and there's 2 different jackets. For cohort 1, they had navy blue, and cohort 2, they had the maroon ones. And so making sure they feel supported and like they're swagged out and decked out. They always love that. They love feeling good and looking good. So making sure they had jackets. We also gave each young person a laptop so that they could, I mean, just for compensation, like whatever they needed it for. It was at the end of the project, so it could not have potentially supported them through the project. That's something that could be evaluated for next time. In addition to that, letters of recommendation. Our first cohort was pretty heavy with upperclassmen, juniors and seniors, some of which are at UC Merced now and UC Berkeley. A lot of the second cohort, they're younger, so like freshmen and sophomores. So offering letters of recommendation for anything that they may need, whether it's a job, being a reference for them, or if it's for school or for college. And then of course, like I mentioned, that network of support. So whatever they may need, supporting them with that. If it's like resume building, because that's in my scope of work, I can support them with like completing that and submitting that, and how to get a job once they're done with this project, and just in any way that they could or potentially foresee themselves needing support in their young adult lives. And so one of our young people in the project, she's not photographed here, but she is the founder of Project Smile. And she's been using youth philanthropy groups to support that and getting stipends and stuff. She's working with UCSF Dental, and she's heading to DC in June to present some of her projects so that she could potentially get more funding from the Changemakers conference over there. And then another one of our young people, after completing the project, applied and was accepted to a summer intensive at UC Davis in the medical field. I'm not sure what he wanted to pursue or what he's looking to pursue, but he wanted to give it a try. And so he stayed over all summer at UC Davis last summer and got some experience, and was super happy and super excited about it, and told us all about it and really enjoyed himself for sure. And so opening up more doors for them as a network of support. And then promising practice number 3, recruitment. Recruitment was the tricky part, I would say, especially for the second cohort. Well, not necessarily recruitment, but retention. Retention was the tricky part. How do we keep kids coming? How do we keep them going? But we reached out to our peers at other CBOs and just put out a mass email. And so these are trusted adults in our network right? And so they have youth that they are familiar with, that they're like, okay, this kiddo would be perfect, or this young person has expressed interest, how can they get a part of this? And then we tried our best to avoid youth who function well, I would say, in like the traditional academic setting or the traditional academic environment, just because we knew that they would obviously excel and they would give us what we wanted as opposed to what we needed, which is typically like this structure that exists within traditional education. Youth know that they need to produce and give the adults in these spaces, okay, they want X, Y, and Z. This is what they're looking for. This is what I'm going to get. But we needed their authentic lived experiences. And so the recruitment of like system impacted youth or Black and Brown youth, which typically wasn't reflected in our first cohort, but we were able to secure some folks in our second cohort, which was super exciting, so that we could have diverse contributions or diverse experiences contributing to the project. And then next slide, please. Thank you. For promising practice number 4, reducing barriers to the participation, making sure that we were in a location where most youth could access the space, whether that's via public transportation or walking distance from school. We have 14 branches within our association, and so we could have gotten creative with where we held our meetings. We just so happened to be in the Stonestown area at the Stonestown YMCA, but it could have varied, right? We wanted to make sure that it was a central access point and that buses were readily accessible to drop off, but then also to go home after we were done with our sessions, because it did end like pretty late, maybe around 7-ish or 7:30 for certain workshops. And then considering other, like another component of the project was barrier removal. And so we have barrier removal specialists that were able to support us if food or kids needed food pantry, diaper distribution, academic support services, workforce development services, giving them like what they needed so that it made participation easier. And then for promising practice number 5, supporting meaningful participation, we wanted to make sure our young people felt invested in. Not that, like I said, we weren't just extracting from them and getting what we needed from them, but they felt related or connected to the to the youth research leads or the people, the adults that were facilitating the space. They felt connected. They felt like reflected and that they can see themselves in these spaces. And also whatever other contributing factors that made the space feel like it was not a traditional school setting. So I know some of the kiddos may have participated in other programs where they know me as Miss Precious, but they could just address me as my first name, right? Because there's respect that goes both ways. If I'm calling this young person by their first name, they also can feel free to call me by my first name. There's not this power dynamic in the space, but also plugging them with other programs that they may potentially need or have access to, like YEF or Youth in Government or MyEAP or E2E, and just building a space that was fun for them to participate in, and not just having it be like curriculum set, but also having those moments to enjoy, moments to laugh. And then lastly, celebrating them. I'm a huge spoiler. I love spoiling my young people and my staff any chance that I get. And so always having a celebration that includes food, that includes certificates, a presentation of their learning, where they get to display and feel like, have that agency of like, okay, I participated in it and now I can show my community like what I've done and take pride in showing my community what I've done. And so we had our young people present their results and their final presentations. They were a little nervous about it, but again, like that leadership development, making sure that they take the time to practice. Public speaking is key in any position or any role that you're doing, in any job that you're doing, and making sure that they felt supported in that presentation. And then next slide, please. Thank you. And then this is our prioritization, like just the process of our priority list and how we came up with it. Youth would typically, after we completed our modules, our 7 modules, youth would survey their communities. So this is typically, all of our youth are a part of SFUSD. So on holidays like spring break, winter break, fall break, they would survey their community, whether that's their family members that are around the same age, if it's their teammates, classmates, clubmates. What are some issues that are like that teens are facing in San Francisco today? And like, what are these concerns? How can researchers handle them? And then they bring the list back cohort 1 bring the list back, and then we were able to like create some questions based on what are some of the emerging themes we saw. But with cohort 2, for the sake of time, they surveyed their communities, they drafted the questions, and then they brought the questions back. They drafted the questions individually, brought them back to the group, and then we consented. Like, do we feel like this is okay? Do we like this question? How are we feeling about this question? Could it be reworded? Anything like that. And then once everyone gave consent and they felt good about it, then we sent our list off to our UCSF research team, who was super helpful. Like, if questions were completely off the mark or they weren't comparative effectiveness research questions, they were then able to like support with tailoring the language. And then we bring that list back to the young people and say, does this still seem like it's true to the nature of the question, the original nature of the question? They said yes, or if they said no, we would have to like meet in the middle somehow, some way, but they said yes, and we were able to go ahead and move forward, and they ranked that. Then they ranked the questions. It's a little tricky when giving them the prompt to rank the questions, because you don't want to make it seem like teen pregnancy is less important than substance abuse, right? Or vice versa, because who knows what any one young person or any person in the room might be battling on the back end, right? These potentially could be their lived experiences. But like, if we wanted these tackled, how did we want them tackled? In what order did we want them tackled from top to bottom? If everything was going to be addressed, what order from top to bottom did you want them addressed in, right? And then that's where they were able to rank, understanding that something, yes, it is a priority, but not necessarily more of a priority than this. Everything's a priority, right? And then, of course, the list will be disseminated to community partners and researchers for them to see and review. Thank you. And then here's some of the emerging themes that came out of, it came really from cohort 2. They were able to identify the themes. And then after looping in cohort 1, they were like, okay, yeah, that makes sense. A lot of our questions also fall into the same categories. But we noticed that generational trauma, mental health, substance abuse, not necessarily use, because there are a lot of young people who are using substances, but then again, these are prescribed for medical purposes or other purposes. But substance abuse, when that transition happens of, I'm going to use this to support me more than just my physical health, right? Haters, all the isms, sexism, racism, ageism, societal standards. So the pressure that society is putting on people, whether that's in education or like physical appearance, social media, things of that sort. Violence, understanding that violence can happen physically, mentally, and emotionally. But this specifically was in reference to physical violence, whether that's physical abuse or like we noticed an escalation in school shootings or school violence in teens, and then physical issues. So things like obesity and other potential health issues they may be experiencing, like diabetes. And it was a lot of having to do with like food and nutrition. There are questions that related to physical health issues. And then I believe in our following slides, there's some question. We have, this is cohort 1's questions, and then in the next slide, it's cohort 2's questions. Specifically, there were 2 questions that I wanted to highlight that overlap, multiple themes are overlapped. So some questions obviously are just having to do with like substance abuse. So what is the most effective way to treat alcohol abuse in teens? That has to do with substance abuse specifically and only. Right. And then there's other questions that have other themes. And the 2 questions that had the most overlap were, how do socioeconomic factors such as income level and access to education influence the initiation and maintenance of unprescribed substance use among young adults in urban areas? That was generational trauma, mental health, substance abuse, haters, and societal standards. They all factored into that question. That was the one question that had the most overlap. And then the second question that had 3 was, what are the short-term and long-term effects of excessive vaping on respiratory health and cognitive function? And how do these compare to the effects of traditional cigarette smoking? So that obviously had generational trauma, like what are those shifts in generational trends that we're seeing, substance abuse, and then physical health issues or like physical health implications on using drugs potentially. And thank you. I don't know if anyone had any questions, or I'm going to kick it to Anda, who's going to share about the impact of the TRUE project.
Great. Thanks so much, Precious. we will be disseminating those research theme priorities and questions to our broader networks, including out through our networks at UCSF. So as you could see, from some of the impacts we had with the Transforming Research as Usual for Equity program was co-developing a consultation model in partnership with UCSF, CTSI, and YMCA San Francisco and the youth research leads. So as an example, we have embedded in the CTSI community engagement consultation portal a link to consult with TRU. We've been disseminating the youth research training curriculum that was co-developed with the youth. We will be disseminating, as I mentioned, the youth research priority list and their themes. And we've been working on and presenting on these best practices, promising practices for partnering and engaging youth in research that we've been learning about and absorbing and now and collating. And now we're really thinking about sustainability and scale, because it has been such a powerful experience to bring all these different councils and advisory groups together. And it seems like because it takes time to build the trust and create the group, it seems like a waste not to continue to use these entities for future researchers, especially as it seems like more research funding is being requesting or requiring advisory.
Anda, you muted yourself.
Ooh, thank you. When did I mute?
You said when studies or applications are depending on
Yeah, they're
asking people to
requiring it more.
provide community advisory.
Yes.
Yeah.
Yeah, exactly. Thank you. I don't know how I muted myself. Sorry. So as more entities and funding mechanisms are requiring these advisory boards, it seems like there is an opportunity for us to have embedded in our infrastructure an existing youth advisory board and major key advisory groups that researchers and other programs can tap into at UCSF. So we're building infrastructure towards that. That includes budgets for incentives for the youth and the resources they need to support the advisory boards, and such as other non-financial incentives that Precious went through. And this does require some infrastructure on our end with staff support and with the YMCA, for example. So we have a little QR code here that has more information about our different youth and young adult advisory boards and councils, in case you're interested in consulting us and learning more about them. We have been being sought out from some of our presentations by research groups here to and have been building support for these advisory councils in current grants that they already have or in grants that they're applying for. And so I'm thinking that might be a resource for others in our institution and in our department, that in the Pediatrics department, that might be of use, but I think also more broadly across our campus. I don't know if anyone else wants to add anything, Sada, Setareh, Precious, or Cassandra, to this sustainability and scale part.
I mean, I want to add that it takes a long time to set these up, and so I think we really are a great resource for UCSF, you know, because the board is already set up, it's already a brave and safe and trusted space, and so rather than do everything all over again, these youth and young adults have a wide range of experiences, and they can help any research question. So I'll just put that out there.
I would also add that in terms of sustainability, having those who have previously participated support in recruitment for new projects. And typically that's what sustained my civic engagement programs, is word of mouth and teens telling each other, like, hey, this is a trusted space. I did it last year. It's pretty dope. Join me. It'll be fun. Trust me. Or get your own turn. And then give it another turn to the next person and stuff like that. Typically, word of mouth from past participants has supported with recruitment and sustainability of programs throughout the years here at the Y.
Thank you. I know we have a few minutes. Roberta, were you
Yeah.
about to say
I
something?
had one question, just because there's so many researchers, you know, in the department who do really more subspecialty kind of focused research. And I mean, the list of questions generated, I mean, that's phenomenal. I mean, it's just great to like have, you know, have people, you know, the youth telling us what's important to them. You know, and obviously that can give people specific ideas about how to think about research questions. But there are a lot of us who do subspecialty research, and you know, and I think, you know, taking what you've said to heart about like, how do you, you know, building your own research board, your own advisory board is really, really time consuming. And many of us do rely on families for that. And how would you advise people to think about that?
I will say one thing, just Emily Perito, for her liver transplant program, reached out to us and for her PCORI Engagement Award, and built in some support for consultation from the YMCA and from our group, just to help her, to your point of navigate some of the challenges and find ways for her to create the infrastructure that might support her work from the beginning, knowing that like none of our current members had liver transplants. So in that type of a subspecialty, we could still provide some consultation and support in that way. Otherwise, like, I think there's a lot of experiences that these youth can give input on, even just like for the subspecialty areas, but to your but you know, not always. And if it's a really super specialized, we could always give advice and on how it's structured. I know we're at 1.
Yeah, I didn't know if any other investigators had specific questions around thinking how, you know, this type of board could help with their research questions, or the couple links. There's an thank you guys for putting all these links in the chat. They're such a great resource. And then we got one comment. Thank you for this great presentation. I really appreciated hearing about your processes and development from Beth Ann.
Cassandra, before, just so it gets captured in the chat, I don't know if we drop a link to the consultation portal and the CTSI community engagement.
Sure.
Thank you. Thanks, Marcia. I know you have so much expertise in this as well.
Yeah, really appreciate your joining us today. Okay. You're putting something else in the chat, Cassandra? Sorry, just don't want to.
I'm trying to pull up the consultation link. It's taking a second.
Okay. This is for the CTSI.
Yes.
Yes. Okay, great. And can people just Anda, since I don't want Cassandra to have to multitask too much, how can people just can we find this through the CTSI? I know we talked about this before, but can we find this now through the CTSI consultation page?
Yeah, and we'll put it on our slides in the future.
Okay.
That part, but
Yeah,
yes.
so just for people's networks, you know, the CTSI consultation page is a great way to kind of start thinking about these things, and this is available there as well. So, okay, thanks everyone for joining us. Thanks to you guys so much for this great presentation. Really appreciate it.
Thanks for having us.
Bye, everyone.
Bye.
Bye.